We like to think about before, during, and after treatment. A diet based on plants before treatment, perfectly fine, not an issue. During treatment, we want to maintain muscle and we want to maintain weight. And it can be very tricky to meet your requirements when you're having just a plant-based diet, especially when you think about your appetite being poor. Maybe you're nauseated, maybe you're vomiting, maybe you've got some symptoms related to the treatment. So a diet based on plants, it really depends on your reasoning behind it as well. If it's because you are thinking that it might get on top of the cancer or something like that, there's not enough research backing it, unfortunately. Post-treatment, it is a fantastic diet because it is so well-rounded. It's got a great nutrient profile. In terms of saturated fats, it's quite low, and we know that saturated fats is one of the reasons that we can have lots of different diseases like heart disease and things like that. So in general, a plant-based diet is a fantastic idea, but during treatment, it can be very tricky to meet your nutrition requirements, especially if you're losing weight and taste and having lots of different symptoms. It is safe to eat soya after a diagnosis of ovarian cancer. Essentially, soya has a profile, a very interesting nutrient profile. What it's got is something called phytoestrogens, which look like estrogen. So we often get confused about whether or not that means it's a promoter of a cancer or whether or not it prevents cancer. But in terms of a whole foods version of soya, like our edamame or soybeans or mung beans, or even some things like chickpeas and beans, which contain isoflavones and phytoestrogens, which again looks like soya. These are perfectly fine because they have a very different reaction when they bind to our receptor sites, different to our actual estrogen hormone. So perfectly fine, perfectly safe to have. I would avoid the more processed forms of that, given that it's a processed food and we don't know how they act in the long term. And in general, we do like to avoid most processed foods, given that it is highly processed and it does have a deleterious effect in terms of lots of different diseases, not just cancer. So limiting that to no more than twice a week when it comes to mock meats that contain soy and tofu and other processed forms of soy. Lots of different foods can help with cancer-related fatigue. In terms of fatigue, we like to think about the effects of whether or not it's cancer, whether or not it's the treatment, whether or not it's because we're not moving so much. In terms of cancer-related fatigue, though, oftentimes it happens as a result of treatment. So as a result of chemotherapy or radiotherapy and things like that. In terms of food, we like to opt for high fat, high energy foods, which can be completely different to the recommendations you might have heard about avoiding these kinds of foods. But things like full fat milk, cheese, custards, those are great ideas. And that is going to help in terms of energy production. And that is perfectly healthy and normal to have, especially when we consider that our metabolic demands are a lot higher during treatment than they are when we're not having treatment. So it's a bit of a double-edged sword in terms of your metabolic needs being a lot higher, but your appetite being quite poor, being quite fatigued, perhaps having other symptoms related to the treatment. So you're not able to meet those metabolic demands. That's when something like nutrition support can come in, whether that's your oral nutrition drinks that your dietitian can facilitate. But also lots of high energy and protein foods that you can have through the diet as well. There's lots of 100 calorie boosters that you can add to fortify your meals as well. For example, adding a bit of peanut butter to a smoothie, like 1 teaspoon or so is a really good amount. Adding some yogurt as well to perhaps a soup, or adding some cheese to some mashed potato. Those are really good ways of boosting the energy content of foods. So I would recommend, wherever possible, fortifying foods as well. We always like to recommend the Eat Well guide, and it's there for a reason as well, because it's quite well balanced in terms of a plant-based approach and in terms of a lean meats approach, promoting the more anti-inflammatory, unprocessed oils like your olive oils. Those are really good ideas. So the Eat Well guide is there for, in general, prevention of lots of different diseases, including cancer. And I'd stick to that guide quite well, especially in terms of the whole grain foods as well. So in terms of specific foods for reoccurrence, there's no evidence to support that one specific food will will mean that it'll prevent cancer reoccurrence. And there's a lot of myths around that as well. Lots of different things that can come up on the internet that can be very confusing. Lots of different foods that might come up, but we like to think about the nutrient profile of the food as well. And the foods that are whole foods and plant based are a great idea just because they're so well balanced, but also preventing or reducing exposure to processed foods, alcohol, saturated fats. Those are really important in general for a healthy diet, and especially for cancer and other diseases as well, and especially some of the other diseases that can happen as a bit of a byproduct if we've got really poor habits in general. For example, if we're having excess sugar from our sugary drinks and things like that, we might get a byproduct of another disease like type 2 diabetes happening, which can further complicate life as well. But yeah, really avoiding the sugar, the alcohol, sorry, reducing the sugar and the alcohol, the saturated fats. And that doesn't mean removing, it means reducing. After a diagnosis, you can absolutely speak to the hospital that you're going to be in contact with and your wider medical department. So we have a cancer centre, for example, where I work at the Guy's Hospital, and we'll have a wider team, and that includes OT, physiotherapists, dietitians, things like that. If you are not sure about who to go to, then the first point of contact will be the nurse or the wider team at the site that you'll be getting treatment, and they can get you in contact with their departments and the wider allied health team. If you're not too sure, you can always speak to your doctor, who can refer you onto a community dietitian as well. But generally speaking, when you are having treatment at the hospital that you're having that treatment, they will have a wide department of dietitians available for you to be in contact with as well. And again, if you're not too sure, there's the British Dietetic Association. That's always a really good resource to coordinate some of our dietetic care as well.